get started with today's episode, I would like to quickly read you our podcast disclaimer. This podcast is for educational purposes only, and it is not to substitute for professional care by a doctor or other qualified medical professional. You should always speak with your physician or other healthcare professionals before doing any fasting, changing your diet in any way, taking or adjusting any medications or supplements, or adopting any treatment plan for a health problem. The use of any other products or services purchased by you as a result of this podcast does not create a healthcare provider-patient relationship between you and any of the experts affiliated with this podcast. Any information and statements regarding dietary supplements have not been evaluated by the Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent any disease. All right, and now we'll get started with today's episode.
Welcome, everyone. My name is Lisa Chance. I'm a fasting coach here at TFM. We are here today with our very own Dr. Fung for our monthly Q&A. This is a monthly Q&A where he answers questions submitted by our TFM community members. And hello to our podcast listeners who will be able to listen to this Q&A with Dr. Fung a few weeks after our community members. Please remember that Dr. Fung cannot answer any medical questions. He's here to answer your fasting and nutrition questions. This question I found kind of intriguing. It was quite a long question, but I kind of broke it down to what I believe she was trying to ask. She was talking about, how in the past women would transition from a perimenopausal to postmenopausal much easier before we started getting all this processed food and everything. So she's saying she's hoping that you may be able to offer us women in this category that are eating holistically, getting our insulin down, would doing that help us transition without hormone replacement therapy easier? Are there any research articles on that, including helping with symptoms like hot flashes, the other things that come with transition into menopause?
Yeah, it's a great question. Unfortunately, I don't know the answer to that. A lot of the data around ultra-processed foods is relatively new, so we don't know. My guess is that it's a bigger problem than most of us recognize. In the past, people talked about ultra-processed foods, mostly in terms of maybe the chemicals that they add are bad for us. But there's actually a lot more to it than that. The processing not only can add chemicals, but the way that it changes the physical structure of the food can be very bad. The speed of absorption. So if you eat ultra-processed foods, it tends to deliver the insulin, the glucose spikes very much higher and very much quicker, which makes a big difference. So there's other things other than the chemical additives that may be an issue with ultra-processed foods. And how do they affect menopause? I don't know that there's a lot of research into that. My guess is that it's probably very important, but the data is still sort of to come. So I couldn't give a definitive answer. The other question about women tolerating menopause better, it always gets confounded because you can't tell if old studies show, people just didn't complain about it as much, right? It was sort of one of these things that you had to deal with. So nobody really took it seriously, right? There is, especially when you go into the older literature, there's a lot of sort of sexist points of view in that case. It was very male dominated, the research back then. So these things weren't taken that seriously. So is it just that we're acknowledging it more, or is it due to the ultra processed foods? Hard to know. If I had to guess, I'd say the ultra-processed foods makes a big difference. I think it impacts a lot of things that we're not fully aware of these days. So I think that movement towards natural foods is a good one. It's just not easy because it dominates the American diet.
Mainlining, it goes in so fast.
Yeah.
It's just kind of insane.
Yeah.
All right. This person says, I'm new to joining the community, and I feel like my learning curve is vertical. Should I really learn the science behind all of this and get my sea legs with fasting? such as solid TRE, doing 16/8 on eating days, and maybe a few days a week of 24s, and then start joining a coaching group or even solo, and then later dive into therapeutic fasting? Or should I join a coaching group right away?
I would join right away because there's always things to learn. You don't have to understand the science of it to do it. You can just do it. And that's the whole community program, which is now laid out in a weekly session, has things to focus on, the eating goals, the fasting goals, but also very important are accountability goals, and there's mindset goals and so on that really help you, because the whole point is that just knowing that you're supposed to do something is not necessarily going to make you do it. Like, for example, we all know we should exercise. We all know we should floss our teeth. It doesn't mean that I'm going to do it. But what makes it easier is, one, establishing that habit, but also getting into groups where people talk about it. It sort of becomes a bit more top of mind so that you think, okay, well, maybe I could skip this, maybe I don't need to eat right away. So a lot of the sort of aspects of losing weight are actually much easier done in a group, in a supportive setting. Like, we know how important it is for all other aspects of behavior change, like Alcoholics Anonymous, right? It's not a magic program. If you did it yourself, you'd probably be 10% as successful as what they are, because they leverage a lot of the sort of accountability. They have sponsors, right? So they have people you can talk to. You can always talk to. There's group meetings. There's all this social things. That's what we're trying to create in the community, is a social support network where we all help each other achieve those goals by talking about it, by thinking about it, by sharing tips, that kind of thing. And that's what you can't get just by reading a book or whatever, right? And that's the thing. If we could all, it's like going to university. If all you need to do is read a book, nobody would pay that amount of money to go to university. It makes no sense at all. It's a lot of money. It's a lot of years. But it's because everything we do practically is done better with a guide, with a teacher, with a peer group, keeping yourself accountable by keeping it fun, that kind of thing. So I would definitely join the group. And like I said, the way it's set up now is you don't need to understand anything. You can just do it. And then as you go, learn some of the stuff we're talking about, why we're doing what we're doing, so you understand why it is. But yeah, I would definitely try to take advantage of the program, which is set out very practically now, just to do this, do this, do this. And then the groups which are there to help you do that.
You're talking about the 12-week cohort that comes with membership, and that is excellent. And I can tell you, as a coach, I can see my clients who have accountability buddies who check in with me or somebody else every week. They do so much better. It's just easier for them, So absolutely. Change all those behavioral habits too, right? This person says, I believe I read or heard you say something to the effect of it's difficult to shed loose skin in autophagy when you have lost the same weight over and over again, regained it and lost it again throughout your life. Could you please talk more about that?
I don't know that there's much data. I mean, the loose skin issue is something that there's not a lot of data on. What's interesting is that most people think of fat loss as purely fat, but it's not. There's actually a lot of associated tissue. One study, and I was trying to find it again because I actually thought it was super interesting, looked at fat cells and what percentage is actually fat and what percentage is actually sort of proteins. And I think it was around 60 something percent of the fat cell is actually fat. Obviously, it changes on how big it is. But what it points out is that whenever you're trying to lose fat, you're actually not trying to just lose fat. You're trying to lose both fat and protein, which consists of skin, connective tissue, blood vessels, all that kind of thing. You get a sense of how much it can be when you see some of these shows on TV where they do the skin surgery. And, people who have lost a lot of fat, they take off, they literally cut off 25 pounds of skin and tissue, right? And that's not fat, that's protein. So the whole point is during autophagy, during fasting, you can activate a little bit of this protein breakdown, and it doesn't necessarily mean that you're losing muscle. Everybody says this, you're losing muscle, you're losing muscle. No, there's a lot of protein that needs to go in addition to the fat. And that's why when we had our clinic, even when people were losing lots of weight, they were having a lot less problems with the loose skin than before. The fasting is a useful method to try to get not just getting the fat, but also getting a little bit of that protein down. And the autophagy is, as best as we can guess, is somewhere around 20 to 30 hours is going to be the sweet spot. When you get beyond 30 hours, your body mostly is just burning fat. So therefore you're not losing as much lean tissue. And that's the thing that people always harp on and on about, is like, oh, you've got lean muscle loss. And I'm thinking, you want to have a little bit of lean muscle loss because it's not purely fat. So if it's 100% fat tissue, you're going to be left with all this excess skin, which is not a good thing. It's just useless stuff. So fasting is a great way. And when we started, it was one of these sort of things that people recognized. It was very important because they didn't see it in other forms, because the other forms of the calorie restriction didn't have that benefit of having the autophagy and so.
Thank you. This person is taking thyroid medication and they want to know, are there any special tricks or accommodations in their fasting schedule when they do have thyroid issues? And I would say it depends on if you're in a flare or not, and if you've checked your labs level right?
Absolutely. So it always comes down to checking the labs, because that's the only way. Symptoms are a very poor guide to what your thyroid level is. And when you're fasting, we've actually heard a lot of people say that their thyroids get better. Certain thyroid diseases are autoimmune in nature, which means that it's your own immune system which is suppressing or destroying your thyroid function. So they become hypothyroid and they need thyroid medication. However, if you do the fasting, and this is anecdotal, but a lot of people have said they check their thyroid and it's actually getting better. And that's possible because if the immune system is settling down. So again, autoimmune means your immune system is attacking itself, which means it's really overactive. When you don't eat, your body wants to sort of shut down anything. And so an overactive immune system is going to get reduced to sort of a normal level. And therefore, maybe the thyroid actually improves, which means that the thyroid medication you're actually overdosing on. So then that's a problem. But again, the symptoms are a poor guide. You actually have to check with your blood work to see. But we've had lots of people say, oh, yeah, I started doing the fasting and then I got off all my thyroid medication. And it's like, it shouldn't actually affect the thyroid. But because it is a common thing that happens, this autoimmune thyroiditis, we do hear it quite a bit, actually. So it's an interesting phenomenon.
Yeah, I have had several clients, and I have one client who actually had thyroid cancer, and she hit it hard, therapeutic fasting, but she always checked her levels every 6 weeks so that her medication was adjusted accordingly. And all her cysts are now empty on imaging. Of course, the doctors are freaking out, and she keeps telling them, I've been fasting. And they're like, how can this have been reversed like this? So it's pretty cool. She's like yelling from the room because they're bringing in another radiologist and, another doctor. And they're like, we've got the wrong x-ray comparison. And she's like, I'm fasting.
Yeah, they don't understand it. That's why, because they never learn about it. There was a patient I had had hemorrhagic cysts, which were bleeding a lot, actually even wound up having to get part of the one kidney taken out because the kidney cysts were always bleeding. Anyway, started fasting. And again, it's the same thing. When you fast, your body wants to sort of shut down any exogenous. Instead of trying to grow, it tries to sort of maintain and repair. And cysts are growing. So therefore, when you're fasting, it tries to reduce that excessive growth. And in fact, her cysts just totally stabilized. She stopped bleeding. And again, it started to shrink. And the same thing, you should go and get an ultrasound. And they're like, well, this can't be right. And she's just, it's okay.
But it's exciting as a coach, to hear that this is happening, and whether they're cyst in the breasts or cyst in the kidneys or cyst in the thyroid. And it's just really, it makes me feel so good. It's so rewarding. So thank you for that, Dr. Fung. This person says, I've read your blog post about who should avoid fat bombs. You want enough fat, but not too much fat. So how does that apply to a fat fast? How many grams of fat should we be eating per meal per day on a fat fast? And I know our fat fast is about 80% fat, right? Unless it's the plant-based, then it's about 70.
Yeah, so the fat is interesting because the way it's metabolized is that when you eat fat, It doesn't go to your liver. It sort of just gets absorbed through the lymph and then gets deposited into the blood where the fat cells then take it out. So it sort of goes directly into fat storage. So that's why eating fat bombs. And so fat bombs was this sort of older idea, which I don't know that anybody does too much anymore, was this sort of ultra fat, something that's just very, very, very high in fat, which people could eat whenever you wanted and however much you wanted. The problem is that, when you go into ketosis is interesting because it tells you that you're in a fat burning state, which is fine. But if you're adding fat at the same time and you're burning fat, well, then you're not losing fat. So eating a lot of fat bombs for no reason is not that good for you. It doesn't make you lose weight. The fat fast is different. You're not trying to eat a whole lot of fat for no reason. You're just trying to eat enough that you're taking the edge off that hunger. So even if you don't lose weight, at least you're getting your body used to the whole process of getting into ketosis and all that. So that's why we call it like a training wheel, because you're not going to get as much fat loss than if you did a full water only fast, for example. Because on a water only fast, you're burning your fat, but you're not adding fat back in, right? Fat fast is just to take that sort of edge off, make it easier and get you into it. And a lot of people find that when they do that, because the amount of fat they're burning in a day is a lot less than they're taking in, they're still losing weight on it. And again, you just want to eat enough that you're not hungry. The point is to make it easier. It's not better necessarily, but some people get great results because you're not having so much of the hunger, because you have to realize there's different reasons why people eat. And some people just feel that deprivation. They feel like, if they can't eat anything, then they're going to wind up binging. So you're just trying to dial it down a little bit so that you're taking it a little easier into that whole process. But yeah, fat bombs is not what we're aiming for with the fat fast. What we're trying to do is just sort of dial back the feeling of hunger, the feeling of deprivation, that kind of thing. And, from experience, I think it works actually quite well. Personally, when I used to do some 5-day fasts, and it used to be like a water only by 3 or 4 days, it was getting not difficult. The physical hunger was never the hardest part. The hardest part was always that sort of mental, psychological, whoa, I really, really want to eat this because it's really delicious. And that's where I found it useful to have a little bit. That's not a full classic fast. On the other hand, it was enough to take the edge off, but not enough that I wasn't still losing weight and getting the other benefits. So it's all a matter of finding what works for you. What works for me, maybe something, I need it usually around day 3, day 4. Some people might need it day 1. It's okay. Yes, you're not going to lose as much weight, but you will still lose weight. I tried the fasting mimicking diet and I actually thought it was too much. I couldn't eat the whole thing because I didn't need to. So I didn't, right? So I think the first day is like, 1,100 calories sort of thing, but it was too much. I was like, I can't eat all that, right? It's like on a fasting day, that's just way too much for me. So I actually just dialed it back. I think I took half of what they did. It really made it easy, I have to say. But for me, it was just too much. So you have to always adjust. And the fat bombs is this idea that you could indulge yourself and eat as much as you want because it's a free food. It's not a free food, but the fast is to dial back that hunger.
We often get this question from clients, and it's a training wheel or a fat bomb, or, like I would always use like a tablespoon of really good. I live near Napa, so really good artisanal farmers market olive oil that's locally grown and really fresh. And I would just take a tablespoon of that. It had a lot of antioxidants in it.
Yeah.
And I would take that any time of the day or night if I was struggling. When I first started, if I was struggling, and I always looked at it as kind of priming the pump. You always talk about 2 different ovens, right? A glucose burning oven and a fat burning oven. I want to get over to that fat burning oven. So I followed your advice, but I'm talking 1 tablespoon. I'm not taking a 500 calorie fat bomb drink, right? A big difference.
Yeah, exactly. These were like little treats that you could make and stuff where, I mean, they're quite a lot, right? And it's exactly right. That's the way to do it, is just to get over there so that you're still staying in that fat burning state, but you're taking a little bit, but because it's mostly fat, you're still staying in that fat burning state. You are adding a little bit of fat back, obviously. That's what you have to do. But because you're staying in there, then you're managing the hunger, but you're managing the sort of mental side as well. So, and that's important.
Mhm. It's not that, oh, goody, I can have a fasting aid. It's like, do I need a fasting aid? Do I really need it right now? Will it help me fast another 12 hours? If not, if I'm just having it because I can have it, that's not the way we do it, right? So,
Exactly, exactly. And that's the thing that I found sometimes it was that, it's like, oh, you can have all this. And I was like, I don't need all that. I'm perfectly fine with like this much. That's all I need to take, right? Because I want my body to burn my own fat. I don't need it to burn the fat that I'm taking in. I'd rather take a little less and let my body burn my own fat and my own sugar.
yes. I have two DEXA questions. So this person says last summer they did a DEXA scan and they noticed that they had gone from osteopenia to osteoporosis. Since then, they have been fitting in workouts, resistance training. What is the best way to fit in your workouts around your fasting schedule? Should you exercise in the fasted state or not? That type of thing.
Yeah, I think exercising in the fasted state is beneficial. And then some people, what they do if they're trying to build muscle, not bone, but muscle, is eat some high protein foods within sort of like 4 hours, 6 hours after the fasting and the workout, because you're more primed to build muscle in that state. For osteoporosis, it's a lot less well defined because people don't know. So people used to think, well, it's a calcium deficiency. It's not a calcium deficiency at all. If you look at osteoporosis around the world, for example, in Japan, they drink about a third of the calcium that Americans do, but they have like 10 times less osteoporotic fractures. It's a huge difference. The question is what causes that difference? And it's not the calcium. That's the point. Because we all get into this state where everybody's like, well, you should drink more milk and you should take more calcium. I don't think that's the issue. I think the issue is one, bones get stronger when you put stress on them. So if you're sitting a lot, and this is the whole problem with North America in general, is that you're sitting more during the day, you're using your car. When you live in the suburbs, for example, you're driving everywhere as opposed to walking. So you're not putting the stress on the bones, and it's only putting stress on bones that causes the bones to get stronger. That's why astronauts get osteoporosis. They're eating fine. So everybody thinks it's what am I eating? What am I eating? Eat more of this. No, no, no. If you need strong bones, you need to put stress on the bone. If you want strong muscles, you need to put stress on the muscles. You can't eat your way out of these things. Can you adjust your eating? Well, the fasting may help because of the increased growth hormone, but that may take a little bit longer. So you may have to get into the longer fast to do that. And of course, when you're eating, you want to make sure you're getting all your good vitamins when you eat. You don't have to eat all the time, but you want to make sure that you get it. Probably need to get out in the sun. Vitamin D is very important. I used to measure vitamin D levels in my patients. Like 90% of them were low because for so long we've been so sort of stay out of the sun, stay out of the sun, that a lot of us are sort of low in vitamin D, and vitamin D is obviously very important for bone development. So osteoporosis is a tricky one because it's actually tied into a whole lot of things, but essentially the resistance exercises is more than the exercise because it's the everyday, what are you doing sort of thing, right? So if you look at a lot of places around the world, they do better because it's not so car centric. Like you go to certain cities and everywhere you go, you walk. I remember in Italy, there's this, you're just walking everywhere. And two, there's hills everywhere, right? So you're always walking up and down stairs. And again, you're putting more stress because let's say even when you're going downhill or downstairs, you're putting a little extra jolt against your bones, which is going to make it stronger. So it's fine to get that extra 30 minutes 3 times a week of your exercise, but it's like, what are you doing 10 hours a day? Are you walking everywhere? That's what's going to make a difference in the long term. It's not that it's so much of a difference, but a little difference over a long period of time can still be a big difference. So osteoporosis is tough, but it's definitely something that increased stress on the bone is probably the most important.
How do you feel about K2, specifically D3 and K2 supplementation?
The K2 is probably much more important than we thought. It's one of these vitamins that lately has been, people are recognizing how important K2 is. So vitamin D and K2, I see it together a lot now too. So people will take it in the same pill almost. So it is worth taking those vitamins if you want, but getting out in the sun is probably as good as anything too, you know.
Eating is the new smoking, they say. So yeah, get out and, walk a little bit throughout the day. Yeah. And this person, the other DEXA question is that she's finally gotten to her goal of 25% body fat. She's no longer type 2 diabetic. She has reversed her non-alcoholic fatty liver disease, but she wants to get that final 5% off. What fasting regime would you suggest for getting to that last weight loss?
Again, everything works differently for different people. So I don't know that there's a best. I think you have to try them and then see what really works well for yourself. It's no different. Like some people like to eat lamb and some people don't. Some people love tofu and some people don't. And some people love eggplant. Some people doesn't mean one's right and one's wrong, right? So if you find that one meal a day works really well, fits into your schedule, easy for you to do. Other people find it really difficult. So it's not that that's the best for everybody, but it'll be the best for you. So I would try the regular ones, but then the ones that people haven't tried as much are the longer fasts. Lately, I've found them more useful. These longer fasts, 3 to 5 days, but not a full fast, like with a little bit of vegetables or something, because I find for myself anyway, that it winds up dominating my thoughts by day 3 and day 4. It's like all I'm thinking about is, oh, this is what I'm going to eat when I eat. Not the physical hunger. There actually is almost no physical hunger. I never feel the physical hunger at day 3, day 4, but I feel the sort of, oh, I should, do this. And I don't know if it's because you get exposed to it so much, because you drive on the highway, you see signs, you see the McDonald's, you see the Tim Hortons at the hospital. It's just in your face all the time. So that's why I actually think that those ones are actually, I find very useful these days. Whereas before I used to do a lot more of the 24-hour fast. So it may change over time too. So that's why I switched over to doing, I still do the 24-hour fast, but now I'd have these sort of longer fasts. And that's not something everybody's done before. And it might be useful to have a coach. And this is where the community is helpful, because they say, well, this is what I found useful for me. It doesn't mean it'll be helpful for you. It means you can try it and then decide for yourself, hey, this was fantastic, or this one really was hard. I don't think I can do it. And it's okay. You're only responsible for yourself. But it doesn't mean that just because it didn't work for you and it worked for me, mean that I'm right or wrong. No, it just means that you have to have some acknowledgement that, hey, this is what I tried and this was what works best for me. Some people don't like fasting at all, and it's okay. If you don't like the fasting, you can always change your diet to sort of natural foods or low carb foods. It works just fine. I think that it is a useful adjunct for a lot of different things. So that's why.
Best fast is the one you can do, right? And learning all of this, the art of the pivot, do you need to pivot up? Do you need to pivot down? Learning to trust your body again, all of this is all the things we teach, right?
Yeah, exactly.
All right. So thank you, Dr. Fung. I am going to go over some of the questions that were repeat questions and tell people where they can find the answers on previous podcasts and articles. We get a lot of questions about calories. The best resources that you can go look at is if you look under resources on our website, all right, and go to the drop-down menu and you'll see Dr. Fung's Medium articles. The Overfeeding Paradox, the Body Fat Thermoset, Part 6 is one of those articles that you can read about calories. And also another one of his Medium articles is What Ozempic, Wegovy, Mounjaro teaches us about weight loss. It's about controlling hunger, not calories. That's the title. Another one that you could look up that's not on our website, but is by Dr. Ben Bickman, who Dr. Fung highly respects. His article is 4 Reasons Calorie Counting Doesn't Work. It's an excellent article. Also, some people asked about kidney stones. You will find answers to that on podcast 189. Another one sent in the questions about the American Heart Association that was blasting fasting and how dangerous it was and increased your risk of heart attack and heart issues. Dr. Fung did a rebuttal article to that. You can find that under the Medium article also. Please remember that it was a poster presentation. It was not a research article. It was also a questionnaire type of data gathering, which is the most inaccurate. It was over an 18-year period, and people did not consider having a coffee and a croissant in the morning as a meal. They considered that as still part of fasting. And nobody was intentionally fasting on that poster presentation. We have a bunch of information on that on various threads over in the community forum. Somebody also asked about protein, the amount of protein. Dr. Fung again referenced that on the last podcast of his, which was number 189. And then somebody also was asking about at-home hemoglobin A1C testing devices. There are several that are out there. I personally like P as in Peter, T as in Tom, S as in Sam, ptsdiagnostics.com. I have no kickback on that or anything. There are several that are out there. That's just the ones that we used in the hospital. I would watch the instruction video several times if you're going to do this at home, because it is a little complicated about doing the quality assurance and stuff on it. They are reasonably accurate. They are required by FDA to be within 6 to 8% of what a lab value would be. So you have the convenience of doing it at home. It usually takes about 5 minutes. The more of them you buy, the less expensive they are. So you can buy packs of 1, 3, all the way up to 12, I believe. All right. I did it 1 year while I did a trailing hemoglobin A1C. In other words, I tested it every month instead of waiting 3 months, because remember, a hemoglobin A1C is the amount of glycation, the amount of sugar attached to a red blood cell over a 3-month period. And I did one every month just to see if what I was doing, my lifestyle was changing. So it can be very effective to help track those. But again, they are more expensive. You could be paying about anywhere between 50 to 75 if you were purchasing it individually, whereas if you bought it in a pack and maybe did your family members, or I did my friends and family, and I bought a big pack. And so then I was more around $12 on those. All right. Insurance may not cover your home testing equipment for this, so I would ask, but again, pay careful attention to the techniques and instructions on that.